and our second speaker is Dr. Emma Seppälä. Emma is a Science Director of Stanford University Centre for Compassion and Altruism, Research and Education, and Facility Director for Yale School of Management Women's Leadership Program. She was also Science Director of Stanford University Centre for Compassion and Altruism, and author of The Happiness Track and an international keynote speaker. She doesn't really have much else to do in her time by the looks of it. Very, very busy. So thank you, Emma. I'll hand over to you now.
Well, thank you so much, Grant and Sherry. Wonderful, wonderful presentation that definitely introduced the topic that I will be speaking of with you now. All right, so Sherry was talking a little bit about stress, stress on the job, post-traumatic stress, and as you know, the job of any police officer or first responder involves situations where you encounter life and death situations, whether you encounter violence or you have to engage in violence, whether you have to walk in on a scene that involves violence in some way, that brings up anxiety, fear. These are situations that can, in some cases, lead to post-traumatic stress. So I'm going to talk a little bit about that right now. It's now called post-traumatic stress. For a while, people were saying post-traumatic stress disorder, but it's actually not a disorder. It's a very normal reaction to a life and death situation here. So post-traumatic stress in the police affects 7 to 19% of the police force versus 3.5% in the general population. Police officers suffer from cumulative post-traumatic stress, so prolonged and repeated exposure. So veterans and general community too will also encounter these kind of situations. Military veterans have often encountered these situations during deployments. Otherwise, and the general population, even a car accident, one-time event can lead to post-traumatic stress. However, when it comes to police officers, there's this sort of cumulative, repeated, day after day sometimes, exposure to these very stressful life events. And that leads to, that can definitely have take a toll on mental health. So what is post-traumatic stress? Involves some of the things Sherry actually looked at in her poll: recurring thoughts, dreams related to trauma, avoidance of stimuli associated with trauma, negative moods and cognitions, irritability, depression, rage, anxiety, sleep disturbance, and then exaggerated startles. So, and again, Sherry was also alluding to all of these things, this sort of overreaction to things that wouldn't normally provoke anxiety, but there's a very strong anxiety response. I have a picture here of David Brown, who's currently superintendent of Chicago Police. And I don't mean to have that picture because he has post-traumatic stress, because I have no idea. But his story is so vividly, it demonstrates this sort of repeated stress, having headed the Dallas police and had members of his force pass away, and then have his own son pass away at the hands of police because anyway, it's a long story and you have to read about it. Now he's just been placed at the head of Chicago Police in April, and now with everything going on in Chicago, just an example of the amount of stress that can come at someone, and obviously does not have to be a chief for that to happen. So what a little bit more about comorbidities with post-traumatic stress, marital and relationship problems, probably because of all of the negative emotional repercussions and irritability, anxiety, substance abuse. Sherry mentioned this sort of a self-medication, insomnia, very, very common, anxiety, depression, social isolation, trust can be impacted. But again, social connection, the things that Sherry's doing with peer-to-peer is so predictive of mental health and well-being. So when you isolate, you're actually sort of removing that support system. Rage and violence. So this can happen very quickly, in the sense that with post-traumatic stress, sometimes there is a lack of ability to sort of control your impulses in the moment. So you might act out in rage in a way that you actually don't want to act out, would never have wanted to act out, and yet you did because that anxiety took over your nervous system. You're in this fight or flight response. So we've all heard of the fight or flight. Post-traumatic stress is like you're in fight or flight all the time, which is why you're unable to sleep, unable to relax, and can really act out in a way that you would rather not. Concentration and attention are impacted, which obviously impacts your job performance, and then suicide. So sadly, police suicides are greater than deaths in the line of duty. And we know that suicide is very tightly correlated with post-traumatic stress, with insomnia, etc. So what are current treatments? Pharmaceutical and therapeutic, exposure therapy, cognitive behavioral therapy. But there are some issues with that, is that research shows that 50% of patients who go through an entire course of treatment show no benefit. They're not helped. So what happens, the problems is that there's a high dropout risk. Often pharmaceuticals have side effects that can really interfere with your ability to function in life, to function on the job. And also pharmaceuticals have mixed results. Therapy often involves revisiting the trauma, which can be very aversive, very unpleasant. And sometimes some people argue it can also be re-traumatizing. And then obviously the stigma that Sherry so deeply talked about, this inability to want to appear weak, etc., or perhaps a fear of losing your job. And then also, if you are someone who is going to become a police officer, if you're someone who wants to be a first responder, you are unwilling to look at yourself as a victim or to want to be dependent on another person or on, drugs, anything, because you're someone who takes responsibility. You're someone who has chosen a profession where you step up. And so there's also that's sort of another factor. So we looked at this question, we looked at a particular breathing practice called SKY breath meditation, decreased post-traumatic stress in veterans with trauma. The population we looked at was veterans, which is very similar to police officers in terms of that post-traumatic stress. And again, as Sherry mentioned, many police officers actually are military veterans. So these are combat veterans. Why did we ask this question? Well, given that current treatments are not working so well, we wanted to try a completely different approach. So traditional approaches, for example, therapeutic approaches, are going to work with your mind, try and get you to think differently so that you can feel better. This can work in some situations. Exposure therapy can also work in some situations. But when there is high anxiety, it is sometimes really challenging to think your way out of a situation. For example, one of the veterans I worked with, he said, I'm in front of the mall. I know there's nothing going on in the mall. I know it's safe in there, but I have to brace myself for 20 minutes before I can walk into the mall. So you see, there's nothing wrong with his cognition. He knew that it was a safe place, yet his body is acting in a way that is not allowing him to go in because of the heightened anxiety. So here we wanted to look at a different approach. Rather than approaching the thinking mind, which is not 100% of the problem here, we needed to approach the nervous system from within. So sort of usually traditional approaches we can think of as top down. Here we wanted to approach it from bottoms up. Can we calm the nervous system using breathing, which we know is the fastest, most efficient way to calm your heart rate and blood pressure and so forth, and to tap into the opposite of the fight or flight, which is your parasympathetic nervous system, the calming response, the rest and digest. Can we do that? Can we try that approach? So that's what we did. I'm not going to go over this design slide. It's really there for you later to look over if you wish. We had a rather small group of participants, but our effect sizes were large. And as you will see, we had longitudinal findings. So really very promising findings. So I'll share with you here. The pictures you see here are from our actual study because there was a documentary made about our study. So we have permission to use these pictures. The participants engaged in a lot of breathing called SKY breath meditation, and as well as some other group processes and social connection, a little bit of those positive psychology aspects that Sherry alluded to earlier. So what did we find? Well, the first thing the main thing we were looking at was anxiety, post-traumatic stress. And what we found was here, what you're looking at in the blue arrow, the blue columns are the control group that did not go through the intervention, and the red columns are the active group that went through the intervention. How long was the intervention? It was a 6-day intervention. Couple hours a day. The participants met every day after work for a couple of hours and did these breathing exercises, etc. So time one is that first set of columns, was before the intervention. Time two was exactly afterwards. So those 7 days later, we saw this significant decrease in PTS symptoms, such as hyperarousal, which is, like I was talking about, that startle response, but also in the other symptoms mentioned below and also in our paper. But, you could send someone to a massage for a week and probably see, similar results. So how do you know if this is really working, right? So we wanted to look at time 3, which was 1 month post. And again, we looked at whether the results had changed. And in fact, they were the same 1 month posts. And then we were fortunate to gather data 1 year later as well. And 1 year later was time 4, and we saw the same. So it was almost like that anxiety, that post-traumatic stress had, in a sense, been healed for the long term. In fact, sometimes some of the veterans will, journalists will want to talk to some of the veterans in our study, and I'll contact the veterans, and they say, I don't even remember what my life was back then. I've moved on, to the point where, these people were living in their basement, smoking pot and drinking, unable to function in some cases, and yet have been able to move on. So very, very promising. Now, if you ask, they might have just liked us a lot, right? And just answer whatever we wanted. So what we really like to do is gather physiological information as well, to make sure that what they're saying is actually what we're seeing at the level of the nervous system. So what we did was measure startle response. What is that? Startle response is, as I was mentioning earlier, sort of a hyper reaction to a small event, right? But that happens when you have high anxiety. So in this case, we actually had them sit in a small room, where the lights were going on and off, and they were hearing loud bursts of white noise at random moments. Now, this would be mildly annoying to someone with no anxiety, but if someone has post-traumatic stress, it's actually very, very startling. One of the veterans said to us, "This is worse than the SEERS program," which is the prisoner of war program in the Marine Corps. So we really didn't want to torture them, and believe me, we tried. Well, this was the least aversive of the kinds of experimental manipulations we could have done. But what we saw here is, what we did is we correlated the decrease in anxiety. So this is what it looked like. We measured startle response around the eyes. This is an actual picture from our study. And what we did, for you who are statistics buffs, we correlated the decrease in anxiety seen in their answers to the questionnaires with decrease in startle response in this sort of very aversive paradigm of having them sit in that room with all of those random noises and lights going on and off. And the correlation was 0.9. So that's a very strong correlation. So there's a very strong sort of relationship between their reduction in anxiety and what we're seeing at the physiological level, helping us feel really confident about our findings. Many people ask, well, did they continue breathing after the program? I mean, did they have to do this every day? The truth is, we measured that, and most of them did not. They did the program and they were done. They were off to their lives. They did not continue breathing, but it's as if that 1 week breathing program, that sky breath meditation, had this acute healing effect on their nervous system that allowed them to then move on with normalized anxiety. So what we're seeing actually is that many of the veterans no longer qualified as having post-traumatic stress after that 1 week, which is what we're seeing here. So this was really very, very promising, and we saw similar results for other anxiety measures that we looked at. And here we looked at respiration as well. So at time 1, respiration for both groups was the same. And at time 2, you see that the respiration for the active group, for the group that went through the breathing protocol, slowed down, suggesting that their fight or flight response was calmed. They were tapping into more of that parasympathetic rest and digest, the calming response. So that was also very promising. Now, recently, we ran a study with a different group of stressed individuals, Yale undergraduates, which you would be surprised how high the stress is among that big group of overachievers who struggle to compete with one another and sort of prove themselves in the world, because they have learned that they have learned or believe that they need to prove themselves to sort of be worthy in many cases. And so what we saw here is we really wanted to look at different well-being interventions, because, you know, there are a lot of studies about this or that random well-being intervention that seems to work, but very few studies that look at well-being interventions side by side. And yet that's the only way we're going to know what works best, right? So we had the participants go through an 8-week program. It was 8 weeks simply because it was during the semester. The actual SKY breath meditation program is short, but what we did was have, and the other programs as well, but what we did was have this sort of continued practice effect to see what would happen if they continue their practice for 8 weeks like this. And what we found was that the SKY breath meditation of all the interventions had far more benefits at the end of the program. And I'm not going to share this with you because I'm not a primary investigator on this study, but this intervention has been studied with the police force in Brazil, and with a lot of success. With police officers, the police officers enjoy the program, and they're seeing a lot of benefits for well-being, but also for social connection among the police officers, and greater feelings of connection with leadership. So really promising results. And for anyone who's interested in that research, let me know. I will be happy to put you in touch with the research group in Brazil. So just to share some testimonials, because it's nice to put some words and some faces behind the data sometimes. This one from Nate Ruska, Marine Corps veteran a few weeks ago, shooting, cars exploding, screaming, death, that was your world. Now back home, no one knows what it's like over there, so no one knows how to help you get back your normalcy. They label you a victim of the war. I'm not a victim. Again, veterans, police officers, not likely to see themselves as victims. How do I get back my normalcy? For most of us, it's booze and Ambien. It works for a brief period, then it takes over your life. Until the study, I could not find right help for me, breathing like a champ. This was Rich Lowe. He was actually in the documentary, if you're interested in seeing it. I feel like I was dead since I came back from Iraq. I feel like I'm alive again. His father actually said, thanks for giving me my son. He said, I've got my son back. And Travis Sienna, thank you for giving me my life back. So again, they were in this study for 1 week, a few days, and saw these huge benefits. So I'm going to take some questions now. I didn't want to overwhelm you with data, but I did want to share with you also my email. And also, if you are interested in that breathing program that is offered for first responders, here's the website, skyresilience.org. And then the documentary film, if you're interested in looking at the documentary film for veterans that was on our veteran study, it's called Free the Mind, and it's available online. So happy to take any questions. I think I have a little bit of time. Any questions, feel free to really jump in on the chat.
There is one question that's come up already, Dr. Seppälä, and that's from Bruce, who says, why Sky Breathe? Can any other breathing technique work as well?
Fabulous question, fabulous question. As a researcher, I really only feel comfortable sharing with you the research that I know and that I have seen work. So I have seen that this program works really well. There are many breathing exercises out there, and probably many work. What's interesting about the Sky Breath meditation is that it's a very comprehensive program. It involves a lot of different practices put together in a package that seems to be very effective in this sort of short amount of time. In 1 week, their anxiety was normalized. These were veterans with post-traumatic stress for whom pharmaceuticals and therapeutics in many cases had not worked. They had been through programs. So there's something about this breathing practice, at least from our research, that suggests that is particularly effective, efficient, and fast for people with trauma, anxiety. And I think we live in a world where we need things to be efficient and fast. So, but I can't speak to things I have not researched. So.
Doctor, just following up from that, Bobby's asked, can you give a brief overview of what Sky is?
Yeah, absolutely. So it involves a number of different breathing practices. During the workshop participants will engage in this sort of guided breathing, and then it involves a number of different steps that would probably take too long here for me to go through. You really do need to take a class for that. But what we know is that after the program, you get this sort of short 20-minute practice, just like you would maybe do a meditation or a relaxation of some sort that you can do on a daily basis. So that's what some people have chosen to do. In fact, some of the veterans actually chose to become instructors of this, which is really nice too, because then it's sort of veterans teaching veterans. By the way, for any of you who are military personnel, it is also available through Project Welcome Home Troops, which is a nonprofit that actually offers this program free of charge. Project Welcome Home Troops, yeah. Any other questions?
Dr. Seppälä, I just want to say that was a fascinating presentation. Thank you so much.
You're more than welcome, Sherry. Feels like a natural partnership with you too. Yeah, so am I referring to transcendental meditation? No, there are many forms of meditation and they are all great, I'm sure. This is just the one, this is really breathing technique. So it's different from meditation, traditional meditation, where you're using a mantra or following some instructions with your eyes closed. You're literally changing your breathing in order to change your nervous system. So we know, for example, that when you breathe in, your heart rate increases. And when you breathe out, your heart rate decreases, right? So when you lengthen your exhales, just a real simple exercise, you start to lower blood pressure, your heart rate. So that's just a tip of the iceberg sort of example of how breathing impacts your nervous system. And BPA Delirious asked what the nonprofit for military is. It's called Project Welcome Home Troops. And I believe the website is, I'll put that in here for everyone to see because I worked with them closely. There we go. Yeah. Yes. And the other thing we know about breathing in particular is that's really tied to our emotions. So you'll see, for example, that when you're feeling anxious, your breathing is going to be more rapid. Same when you're angry. And yet what research shows is that when you actually change your breathing, you can actually change how you feel. And that's really powerful because from research on emotion regulation that was conducted in the lab I was in at Stanford, actually, it's very hard to talk your way out of an emotion when the emotion is very strong. If it's a mild emotion, you can talk your way out of it. But if it's very strong, real strong anxiety, real strong fear, real strong anger, rage, at that moment, I think we've all experienced it's very hard to talk our way out of it. That's again why we want to address the nervous system directly through breathing. How do individual officers get SKY if their organization doesn't have it? I'm a researcher, so I'm not sort of part of the SKY Resilience program, but this website that I have up, skyresilience.org, you can actually just contact them and find out about what your options are and whether you can take the class online. Everything is offered online anyway, so it doesn't really matter where you are in the world or so forth. Yep, I agree with Bruce. Everything needs to be evidence-based for sure. Any other questions? It's my pleasure and honor to be here, by the way. Really appreciate your being here with you all.
Thanks very much, Dr. Seppälä. That was another outstanding presentation. I mean, what a morning and a good way to kick off day 3. I want to just thank everyone that is tuned in this morning, my time, this evening around the rest of the world, etc. It's been hugely informative. If you need to look or obtain any further information, can I direct you to the Resilience Symposium website? All the information is there, and I know that all these presentations will be put up on the YouTube site, I guess, once Jeff gets a chance to breathe. We'll finish up there now. Wherever you are, please stay safe, look after yourself, and in particular, look after your loved ones. Thanks again, and enjoy the rest of the day.